MobiTest, the smart Parkinson's detector. What is the problem? Parkinson's disease in the United States is a pandemic in and of itself, with 1 million living with Parkinson's and only 60,000 diagnoses per year. According to Parkinson.org, medications alone cost an average of $2,500 a year, and therapeutic surgery can cost up to $100,000 per person. Now, with less access to medical facilities, the number of untreated or undiagnosed patients are skyrocketing. Here's the solution. Early diagnosis is the only effective solution for a better life for patients, as there is no cure yet. On average, people get diagnosed at the age of 60, which increases their average life expectancy by only 16 years. However, actor Michael J. Fox got tested at the age of 30 and is a survivor of Parkinson's at the age of 60 because of early diagnosis. This is where MobiTest comes into play. What is MobiTest? MobiTest is an easy-to-use, non-invasive Parkinson's detector that can effectively rate the severity of a patient's Parkinson's all at home. This is especially important because during this time, not many people have access to a medical facility to get treatment for Parkinson's, given that most medical facilities are overflowed with COVID-19 patients. Another important feature of the app is that it's non-invasive. This means that it doesn't harm the body in any way, such as in a blood test. How does it work? MobiTest is built on the Flutter Dart framework, enabling cross-platform compatibility. The user has to take a series of tests, such as the static spiral test, the dynamic spiral test, and the stability test, to get an accurate rating for their UPDRS, or the Universal Parkinson's Disease Rating Scale. More features and UI. There's also an info button on the app bar that, when clicked, gives all the information one needs to use this app. I put a lot of time into making the UI look simplistic and easy to use. Here are some examples. Now here's the demo. So now we're going to open the app on an iOS device, and we're going to click the icon on the top right to open the instructions on how to use the app. And shortly thereafter, we're going to start the static spiral test. After the static spiral test is over, we'll see a graph that shows the overall fluctuation of the finger while drawing around the spiral. And now we're going to start the dynamic spiral test. As you can see, the spiral is flashing on and off to make the test harder. At the end of the dynamic spiral test, we'll see a similar graph showing the same kind of fluctuation, and we result with 1%. So as you can see, this works perfectly fine on an Android device. I can also open up the info page, the same. The graph shows up. And for the sake of this demo, I have skipped the 2 spiral tests to demo the stability test. So I'm going to take it. I have to wait for 10 seconds before it'll show me any info. So I had a slight bit of wavering, which is fine. So my stability test results came out to be 4. So what do these results mean? For a 1% for the spiral test and a 4 on the stability test, those scores are extremely close to 0, which means that I have very low risk Parkinson's. Whereas If someone had, say, for example, 50% on the spiral test, or maybe up to 100 on the stability test, they might be at higher risk of Parkinson's and should contact their doctor as soon as possible.